Welcome future nurses. Today, we are diving into one of the most tested areas on the NCLEX, priority questions. Who do you save first? Ambulance. These questions are designed to sharpen your critical thinking skills and train you to think like a safe, effective nurse. We'll go through 50 carefully crafted NCLEX-style questions, complete with detailed rationales and strategies, so you don't just memorize answers, you actually understand the why behind each decision. If you've ever struggled with prioritization, this is the video that will transform your confidence and help you pick the right answer every time. Grab your notebook, stay focused, and let's get started. Question 1. You are the nurse in the emergency department. 4 clients arrive at the same time. Who do you see first? A 32-year-old with a dislocated shoulder complaining of 8/10 pain. B. 45-year-old with chest pain radiating to the left arm and jaw. C. 60-year-old with nausea, vomiting, and diarrhea for the last 12 hours. D. 25-year-old with a fractured wrist and stable vital signs. Answer, B. Rationale: this is a classic sign of myocardial infarction, a circulation emergency that can lead to sudden death. Requires immediate ECG, oxygen, nitroglycerin, aspirin. Strategy: ABCs first, circulation problem outweighs pain and dehydration. Question 2. 4 clients are on your assignment. Who do you assess first? A post-op client with 100 ml serosanguinous drainage in 8 hours. B. Diabetic client with blood glucose of 65 mg per deciliter. C. COPD client with O2 sat of 88% on room air. D. Patient with urinary retention complaining of suprapubic discomfort. Answer, B. Rationale: hypoglycemia can quickly lead to seizures or coma if untreated. Needs rapid glucose replacement. Strategy: treat immediately life-threatening problems first, low glucose threatens brain function faster than other issues. Question 3. During a mass casualty event, which client is your priority? A. Open femur fracture, cap refill less than 2 seconds. B. Superficial burns on both arms. C. Head trauma, GCS6, irregular respirations. D. Minor abrasions, stable. Answer, C. Rationale: low GCS plus irregular respirations equals airway compromise and possible herniation. Needs airway management first. Strategy: airway and breathing always first in triage, neuro plus breathing risk equals top priority. Question 4. Who do you assess first? A. Client on heparin drip, APTT 70 seconds, no bleeding. B. Client with asthma, audible wheezes, O2 sat 88%. C. Client with DVT complaining of calf pain. D. Client with fever 102 degrees Fahrenheit post-op. Answer, B. Rationale: wheezing with hypoxia equals airway obstruction risk. Can rapidly progress to respiratory arrest. Strategy: choose airway/breathing problems before pain, bleeding risk, or fever. Question 5. Who do you see first? A. Appendicitis, pain 9 out of 10. B. New slurred speech and facial droop. C. Kidney stone pain. D. Chronic back pain 7 out of 10. Answer, B. Rationale: new neuro changes suggest stroke/TIA. Time-sensitive intervention needed to prevent permanent brain damage. Strategy: acute neurodeficits outweigh pain complaints. Question 6. Which patient do you assess first? A. Client with acute pancreatitis, pain 8/10. B. Client with pneumonia, RR32, SpO2 84%. C. Client with urinary retention, BP 150/88. D. Client waiting for discharge education. Answer, B. Rationale: critically low O2 saturation equals severe hypoxemia. Must correct oxygenation quickly to prevent respiratory failure. Strategy: address oxygenation problems before pain or comfort needs. Question 7. Which patient is priority? A. Client with anaphylaxis receiving epinephrine, still wheezing. B. Client with fractured femur intraction. C. Client with constipation for 3 days. D. Client with controlled blood pressure. Answer, A. Rationale: persistent wheezing after treatment means airway still compromised, may need repeat epinephrine or intubation. Strategy: airway issues are always first, even after intervention. Question 8. Who do you see first? A. Client with DKA, Bg 380 mg per deciliter, Kussmaul respirations. B. Client with hypoglycemia, Bg 50 mg per deciliter. C. Client with vomiting x 4 hours, dry mucous membranes. D. Client with mild ankle sprain. Answer, B. Rationale: severe hypoglycemia causes rapid brain injury. Needs immediate glucose replacement. Strategy: choose the most rapidly fatal condition first, low sugar kills faster than high sugar. Question 9. You have 4 patients. Who is priority? A. Client on PCA pump sleeping peacefully. B. Post-op day 1 with HR 130, BP 88 of 56. C. Client with dementia trying to get out of bed. D. Client with cast complaining of itching. Answer, B. Rationale: tachycardia plus hypotension equals possible shock or internal bleeding. Requires rapid intervention. Strategy: circulation threat takes priority over safety or comfort issues. Question 10. Who is priority? A. Client with asthma attack using rescue inhaler. B. Client with chest tube drainage 100 milliliters last hour. C. Client post-op appendectomy complaining of 7/10 pain. D. Client with UTI fever 100.4 degrees Fahrenheit. Answer, A. Rationale: asthma attack compromises airway and can progress to respiratory failure. Strategy: airway first, choose breathing problem over pain, fever, or output change. Question 11. 4 patients are waiting. Who do you see first? A. Post-op hip replacement requesting pain meds. B. Diabetic client with Bg 500 mg per deciliter. C. Client with new onset confusion. D. Client with controlled hypertension. Answer, C. Rationale: sudden confusion may signal hypoxia, hypoglycemia, stroke, or sepsis, all urgent problems. Strategy: acute mental status changes equals priority, as they can indicate life-threatening conditions. Question 12. Which patient is your priority? A. Client with pleural effusion complaining of dyspnea. B. Client with mild chest discomfort, ECG normal. C. Client with sore throat and white patches. D. Client waiting for 4 antibiotic. Answer, A. Rationale: dyspnea equals breathing compromise. Requires oxygen and possible drainage procedure. Strategy: always choose breathing problems first over comfort or scheduled treatment. Question 13. Who do you assess first? A. Client with head laceration, actively bleeding. B. Client with migraine headache. C. Client with chronic osteoarthritis pain. D. Client waiting for discharge papers. Answer, A. Rationale: active bleeding can lead to hypovolemia and shock if uncontrolled. Strategy: circulation problems take priority over pain and education. Question 14. Which patient do you see first? A. Client with hemophilia who fell and has knee swelling. B. Client with small stage 2 pressure ulcer. C. Client with cataract pre-op. D. Client asking about diet teaching. Answer, A. Rationale: joint swelling and hemophilia equals internal bleeding, hemarthrosis. Must treat early to prevent joint damage. Strategy: uncontrolled bleeding risk outweighs chronic or routine care needs. Question 15. Who is first? A. Client with seizure history, actively seizing. B. Client with Bg 250 mg per deciliter. C. Client with fractured rib, stable vitals. D. Client with abdominal distension. Answer, A. Rationale: active seizure puts airway at risk, must ensure safety, position patient, and protect airway. Strategy: airway and safety come first before all other issues. Question 16. Who do you assess first? A. Client with CHF, crackles in lungs, O2 sat 84%. B. Client with fever 101.8 degrees Fahrenheit. C. Client with chronic arthritis flare-up. D. Client requesting sleeping pill. Answer, A. Rationale, low O2 plus crackles equals pulmonary edema, possible respiratory failure. Strategy, address oxygenation problems first. Question 17. Which patient first? A. Client with PE, sudden chest pain and dyspnea. B. Client with cellulitis requesting antibiotics. C. Client with ear infection. D. Client asking for discharge papers. Answer, A. Rationale, pulmonary embolism is life-threatening, can lead to death within minutes. Strategy, choose sudden chest pain plus SOB first, always think clot or MI. Question 18. You have 4 patients. Who first? A. Client with post-op ileus. B. Client with hematemesis. C. Client with mild dehydration. D. Client with controlled asthma. Answer, B. Rationale, vomiting blood equals risk of massive blood loss hypovolemic shock. Strategy, circulation threat comes before GI discomfort or chronic issues. Question 19. Who is your priority? A. Client with burns to face and singed nasal hairs. B. Client with burns to both legs, stable vitals. C. Client with burns to back, pain 9 out of 10. D. Client with partial thickness burn to arm. Answer, A. Rationale, facial burns and singed hair suggest inhalation injury. Airway can swell rapidly, intubate early. Strategy, airway first, treat before it closes. Question 20. Which client should be seen first? A. Client with post-op pain 8 out of 10. B. Client with trach who has thick secretions and difficulty breathing. C. Client with BG 220 mg per deciliter. D. Client with mild diarrhea. Answer, B. Rationale, airway obstruction from secretions equals risk for hypoxia. Require suctioning. Strategy, airway takes top priority. Question 21. Who is priority? A. Client with new onset hematuria. B. Client with BP 78/40, weak pulse. C. Client with rash and itching. D. Client requesting medication refill. Answer, B. Rationale, hypotension with weak pulse equals shock. Needs immediate intervention to restore perfusion. Strategy, circulation threat over everything else. Question 22. Which patient first? A. Client with chest tube disconnected from drainage system. B. Client with urinary catheter leaking. C. Client with migraine asking for dark room. D. Client with low potassium 3.2 milliequivalent/L, no symptoms. Answer, A. Rationale, chest tube disconnection risks pneumothorax. Reconnect or place tube in sterile water immediately. Strategy, life-threatening complication first. Question 23. Who is first? A. Client with SOB and use of accessory muscles. B. Client with BG 310 mg per deciliter. C. Client with constipation x 3 days. D. Client with chronic wound dressing change due. Answer, A. Rationale, labored breathing equals impending respiratory failure. Strategy, breathing problem outweighs metabolic or comfort issues. Question 24. Who do you see first? A. Client with suspected DVT, leg warm and swollen. B. Client with stroke 2 hours ago, slurred speech. C. Client with sprained wrist. D. Client with chronic cough. Answer, B. Rationale, stroke within treatment window needs immediate assessment for thrombolytics. Strategy, time-sensitive neuroemergency first. Question 25. Who is priority? A. Client with BG 55 mg per deciliter, drowsy. B. Client with nosebleed. C. Client with diarrhea 4x today. D. Client with mild fever 99 degrees Fahrenheit. Answer, A. Rationale, severe hypoglycemia, risk of coma. Strategy, choose the condition that can kill fastest. Question 26. Which client first? A. Client with tension pneumothorax, tracheal deviation. B. Client with pleuritic chest pain but stable vitals. C. Client with ear pain. D. Client with mild headache. Answer, A. Rationale, tension pneumothorax equals life-threatening. Must decompress immediately. Strategy, airway/breathing emergency first. Question 27. Who do you assess first? A. Client with HR 150, BP stable. B. Client with post-op incision slight redness. C. Client with vomiting, unable to keep fluids down. D. Client with BG 400 mg per deciliter, alert. Answer, A. Rationale, tachycardia 150 equals risk of decompensation. Maybe arrhythmia or shock. Strategy, unstable vital signs first. Question 28. Who is first? A. Client with chest pain, diaphoresis. B. Client with mild abdominal pain. C. Client with ankle sprain. D. Client with sore throat. Answer, A. Rationale, chest pain plus diaphoresis equals MI until proven otherwise. Strategy, always rule out cardiac event first. Question 29. Who do you assess first? A. Client with BG 75 mg per deciliter. B. Client with new oxygen requirement. C. Client with mild itching. D. Client awaiting teaching. Answer, B. Rationale, new oxygen need equals worsening respiratory status. Strategy, respiratory changes first. Question 30. Who do you see first? A. Client with severe headache, BP 220 of 110. B. Client with mild nosebleed. C. Client with diarrhea 2x. D. Client with ankle pain. Answer, A. Rationale, hypertensive crisis risk for stroke or organ damage. Strategy, choose life-threatening hypertension first. Question 31. Who is priority? A. Client with severe abdominal pain and board-like abdomen. B. Client with mild nausea. C. Client with chronic constipation. D. Client waiting for discharge. Answer, A. Rationale, board-like abdomen equals peritonitis, possible perforation. Surgical emergency. Strategy, choose acute over chronic symptoms. Question 32. Which client first? A. Client with potassium 2.8 milliequivalent/L. B. Client with sodium 150 milliequivalent/L. C. Client with hemoglobin 10G/DL. D. Client with BG 210 mg per deciliter. Answer, A. Rationale, severe hypokalemia can cause arrhythmias. Must replace immediately. Strategy, choose the electrolyte imbalance that can stop the heart. Question 33. Who is first? A. Client with tracheostomy with large mucus plug. B. Client with UTI burning urination. C. Client with mild cough. D. Client asking about diet. Answer, A. Rationale, plugged trach equals airway obstruction. Must suction. Strategy, airway problem always first. Question 34. Who do you see first? A. Client post-op 1 hour with no urine output. B. Client with post-op 1 hour O2 sat 80%. C. Client with post-op 1 hour pain 8/10. D. Client with post-op mild nausea. Answer, B. Rationale, critically low O2 equals hypoxia. Strategy, correct oxygenation before anything else. Question 35. Who is priority? A. Client with new chest tube air leak. B. Client with BG 320 mg per deciliter. C. Client with stage 1 pressure injury. D. Client with headache 3/10. Answer, A. Rationale, new air leak may indicate dislodgement or pneumothorax. Strategy, chest complications first. Question 36. Who first? A. Client with seizure aura. B. Client with BG 250 mg per deciliter. C. Client with constipation. D. Client with mild cough. Answer, A. Rationale, aura equals seizure about to happen. Must protect airway, safety. Strategy, prevent harm before it happens. Question 37. Who do you see first? A. Client with new HR 40 BPM. B. Client with mild temp 99 degrees Fahrenheit. C. Client with sprained ankle. D. Client awaiting discharge. Answer, A. Rationale, bradycardia 40 can cause poor perfusion syncope, arrest. Strategy, choose unstable vital signs first. Question 38. Who is priority? A. Client with hemoglobin 6G/DL. B. Client with hemoglobin 11G/DL. C. Client with ankle pain. D. Client with mild sore throat. Answer, A. Rationale, hemoglobin 6 equals severe anemia, risk of shock. Needs transfusion. Strategy, critical lab values first. Question 39. Who do you see first? A. Client with new onset wheezes after antibiotic. B. Client with BG 140 mg per deciliter. C. Client with constipation. D. Client with mild edema. Answer, A. Rationale, wheezing after med equals anaphylaxis risk. Stop drug, treat airway. Strategy, airway reactions first. Question 40. Who is first? A. Client with HR 180, dizzy. B. Client with mild pain 4 out of 10. C. Client with chronic rash. D. Client with mild cough. Answer, A. Rationale, HR 180 plus dizziness equals unstable tachyarrhythmia. Strategy, unstable vitals equals first priority. Question 41. Who do you see first? A. Client with chest tube draining bright red blood greater than 150 milliliters per hour. B. Client with BG 250 mg per deciliter. C. Client with nausea. D. Client asking for water. Answer, A. Rationale, excessive chest drainage equals hemorrhage risk. Strategy, circulation emergency first. Question 42. Who first? A. Client with RR8 per minute on opioid PCA. B. Client with chronic arthritis pain. C. Client with nausea. D. Client with BG 190 mg per deciliter. Answer, A. Rationale, respiratory depression from opioid airway emergency. Strategy, breathing always first. Question 43. Who is priority? A. Client with potassium 6.8 milliequivalent/L. B. Client with sodium 147 milliequivalent/L. C. Client with BG 180 mg per deciliter. D. Client with constipation. Answer, A. Rationale, hyperkalemia risk for fatal arrhythmias. Treat immediately. Strategy, electrolyte imbalance that can stop the heart first. Question 44. Who first? A. Client with sudden severe back pain, tearing sensation. B. Client with mild sore throat. C. Client with chronic cough. D. Client with constipation. Answer, A. Rationale, tearing back pain equals aortic dissection. Surgical emergency. Strategy, choose sudden, severe, life-threatening symptoms first. Question 45. Who do you see first? A. Client with epiglottitis, drooling. B. Client with mild ear pain. C. Client with runny nose. D. Client with mild rash. Answer, A. Rationale, drooling equals airway obstruction risk. Needs immediate intubation. Strategy, airway emergencies always top priority. Question 46. Who first? A. Client with peritoneal dialysis cloudy effluent. B. Client with mild constipation. C. Client with Bg 210 mg per deciliter. D. Client with sprained ankle. Answer, A. Rationale, cloudy effluent equals peritonitis. Can become sepsis quickly. Strategy, infection with systemic risk first. Question 47. Who do you see first? A. Client with chest pain unrelieved by nitro. B. Client with mild nausea. C. Client with chronic back pain. D. Client with mild edema. Answer, A. Rationale, chest pain unrelieved equals unstable angina/MI. Risk of death. Strategy, unstable cardiac symptoms first. Question 48. Who is priority? A. Client with sickle cell crisis, chest pain. B. Client with sickle cell, mild joint pain. C. Client with headache. D. Client with constipation. Answer, A. Rationale, chest pain in sickle crisis equals acute chest syndrome. Life-threatening. Strategy, choose condition causing hypoxia first. Question 49. Who first? A. Client with neutropenia, fever 100.8 degrees Fahrenheit. B. Client with Bg 220 mg per deciliter. C. Client with mild diarrhea. D. Client with runny nose. Answer, A. Rationale, fever and neutropenia equals sepsis risk. Treat immediately. Strategy, immunocompromised fever is always priority. Question 50. Who do you assess first? A. Client with laryngeal edema after bee sting. B. Client with mild itching. C. Client with sprained ankle. D. Client with chronic wound. Answer, A. Rationale, laryngeal edema can completely obstruct airway in minutes. Strategy, airway obstruction always first, intervene immediately. And that's it, you just worked through 50 priority NCLEX questions with detailed rationales and strategies. Remember, NCLEX is not about remembering facts, it's about making the safest choice for your patient. The more you practice questions like these, the faster you'll be at spotting airway issues, recognizing life-threatening complications, and putting safety first. If this was helpful, hit that like button, subscribe for more NCLEX prep videos, and share this with a nursing friend who needs to level up their prioritization skills. You are getting closer every day to becoming a licensed nurse. Keep pushing, keep practicing, and I'll see you in the next video.